male infertility? Well, nearly 1 in 7 couples is infertile, which means they have not been able to conceive a child even though they have had frequent unprotected sexual intercourse for a year or longer. In up to half of these couples, male infertility plays at least a partial role. Male infertility can be caused by low sperm production, abnormal sperm function, or blockages that prevent the delivery of sperm. Illnesses, injuries, chronic health problems, lifestyle choices, and other factors may contribute to male infertility. The inability to conceive a child can be stressful and frustrating, but a number of treatments are available for male infertility. Let me tell you the symptoms. Well, the main sign of male infertility is the inability to conceive a child. There may be no other obvious signs or symptoms. In some cases, however, an underlying problem such as an inherited disorder, hormonal imbalance, dilated veins around the testicle, or a condition that blocks the passage of sperm causes signs and symptoms. Signs and symptoms you may notice include problems with sexual function, for example, difficulty with ejaculation or small volumes of fluid ejaculated, reduced sexual drive, or difficulty maintaining an erection, that is known as erectile dysfunction. Pain, swelling, or a lump in the testicular area, recurrent respiratory infections, inability to smell, abnormal breast growth, that is gynecomastia, decreased facial or body hair, or other signs of a chromosomal or hormonal abnormality. A lower than normal sperm count, that is fewer than 15 million sperm per milliliter of semen, or a total sperm count of less than 39 million per ejaculate. You should see your doctor if you have been unable to conceive a child after a year of regular unprotected intercourse, or sooner if you have any of the following conditions: erection or ejaculation problems, low sexual drive, or other problems with sexual function, pain, discomfort, or a lump or swelling in testicular area, a history of testicular, prostate, or sexual problems, a groin, testicle, penis, or a scrotal surgery, or a partner over age 35. Well, earlier on this channel I have already posted a video about female infertility. I suggest that you should watch that video along with this video so that you can understand both fertility issues, in female and male. Okay, and in this video I'm discussing about male infertility in particular. Now let me tell you the causes. Male fertility is a complex process. To get your partner pregnant, these conditions must be fulfilled. First of all, you must produce healthy sperm. Initially, this involves the growth and formation of the male reproductive organs during puberty. At least one of your testicles must be functioning correctly, and your body must produce testosterone and other hormones to trigger and maintain sperm production. Sperms have to be carried into the semen. Once sperms are produced in the testicular, delicate tubes transport them until they mix with semen and are ejaculated out of the penis. There needs to be enough sperm in the semen. If the number of sperm in your semen, sperm count is low, it decreases the odds that one of your sperm will fertilize your partner's egg. A low sperm count is fewer than 15 million sperm per milliliter of semen, or fewer than 39 million per ejaculate. Sperm must be functional and able to move. If the movement, that is motility or function of your sperm, is abnormal, the sperm may not be able to reach or penetrate your partner's egg. Now I'll tell you the medical causes. Problem with male fertility can be caused by a number of health issues and medical treatments. So first condition is varicocele. Varicocele is a swelling of the veins that drain the testicle. It is the most common reversible cause of male infertility. Although the exact reason that varicoceles cause infertility is unknown, it may be related to abnormal blood flow. Varicoceles lead to reduced sperm quantity and quality. Infection. Some infection can interfere with sperm production or sperm health, or can cause scarring that blocks the passage of sperm. These include inflammation of the epididymis, that is epididymitis, or testicles, that is or curtis, and some sexually transmitted infections, including gonorrhea or HIV. Although some infections can result in permanent testicular damage, most often sperms can still be retrieved. Ejaculation issues. Retrograde ejaculation occurs when semen enters the bladder during orgasm instead of emerging out from the tip of the penis. Various health conditions can cause retrograde ejaculation that include diabetes, spinal cord injuries, medications, and surgery of the bladder, prostate, or urethra. Antibodies that attack sperm. Anti-sperm antibodies are immune system cells that mistakenly identify sperm as harmful invaders and attempt to eliminate them. Tumors. Cancers and non-malignant tumors can affect the male reproductive organs directly through the glands that release hormones related to reproduction, such as the pituitary gland, or through unknown causes. In some cases, surgery, radiation, or chemotherapy to treat tumors can affect male fertility. Undescended testes. In some males during fetal development, one or both testicles fail to descend from the abdomen into the sac that normally contains the testicles, that is scrotum. Decreased fertility is more likely in men who have had this condition. Hormonal imbalances. Infertility can result from disorder of the testicles themselves or an abnormality affecting other hormonal systems, including the hypothalamus, pituitary, thyroid, and adrenal glands. Low testosterone, that is male hypogonadism, and other hormonal problems have a number of possible underlying causes. Defects of the tubule that transport sperm. Many different tubes carry sperm. They can be blocked due to various causes, including inadvertent injury from surgery, prior infections, trauma, or abnormal development, such as with cystic fibrosis or similar inherited conditions. Blockage can occur at any level, including within the testicle, in the tube that drain the testicle, in the epididymis, in the vas deferens, near the ejaculatory ducts, or in the urethra. Chromosomal defects. Inherited disorders such as Klinefelter syndrome, in which a male is born with two X chromosomes and one Y chromosome instead of one X and one Y, causes abnormal development of the male reproductive organs. Other genetic syndromes associated with infertility include cystic fibrosis and Kallmann syndrome. Problems with sexual intercourse. These can include trouble keeping or maintaining an erection sufficient for sex, that is erectile dysfunction, premature ejaculation, painful intercourse, and anatomical abnormalities such as having a urethral opening beneath the penis, that is hypospadias, or psychological relationship problems that interfere with sex. Another condition, that is celiac disease. Celiac disease is a digestive disorder caused by sensitivity to a protein found in wheat called gluten. The condition may contribute to male infertility. Fertility may improve after adopting a gluten-free diet. Well, on my channel, I have already uploaded a video about celiac disease in English that is available to watch. The link will appear in I button. You can watch that video, okay? And also there are certain medications such as testosterone replacement therapy, long-term anabolic steroid use, cancer medication, that is chemotherapy, and some ulcer drugs, some arthritis drugs, and certain other medications can impair sperm production and decrease male fertility. Prior surgery. Certain surgeries may prevent you from having sperm in your ejaculate, including vasectomy, scrotal or testicular surgeries, prostate surgeries, and large abdominal surgeries performed for testicular and rectal cancers, among others. Now I should tell you some environmental causes. Well, overexposure to certain environmental elements such as heat, toxins, and chemicals can reduce sperm production or sperm function. Specific causes include industrial chemicals, extended exposure to certain chemicals, pesticides, herbicides, organic solvents, and painting materials may contribute to low sperm counts. Heavy metal exposure. Exposure to lead or other heavy metals also may cause infertility. Radiation or X-rays. Exposure to radiation can reduce sperm production, although it will often eventually return to normal. With high doses of radiation, sperm production can be permanently reduced. Overheating the testicles. Elevated temperatures may impair sperm production and function, although studies are limited and are inconclusive. Frequent use of saunas or hot tubs may temporarily impair your sperm count. Sitting for long periods, wearing tight clothing, or working on a laptop computer for long stretches of time also may increase the temperature in your scrotum and may slightly reduce sperm production. But the research is not conclusive. Then there are some lifestyle and other causes which I should tell you. These causes are drug use. For example, anabolic steroids taken to stimulate muscle strength and growth can cause the testicles to shrink and sperm production to decrease. Use of cocaine or marijuana may temporarily reduce the number and quality of your sperms as well. Alcohol use. Drinking alcohol can lower testosterone levels, cause erectile dysfunction, and decrease sperm production. Liver disease caused by excessive drinking may also lead to fertility problems. Tobacco smoking. Men who smoke may have a lower sperm count than do those who do not smoke. Second-hand smoke also may affect male fertility. Weight. Obesity can impair fertility in several ways, including directly impacting sperm themselves as well as by causing hormone changes that reduce male fertility. Okay. Now I should tell you some complications. Complications of male infertility can include stress and relationship difficulties related to the inability to have a child, expensive and involved reproductive techniques, increased risk of testicular cancer, melanoma, colon cancer, and prostate cancer. Okay. Now I'll tell you some preventive measures. Well, male infertility is not always preventable. However, you can try to avoid some known causes of male infertility. For example, you do not smoke, limit or abstain from alcohol, steer clear of illicit drugs, maintain a healthy weight, do not get a vasectomy, avoid things that lead to prolonged heat for the testicles. Reduce stress, avoid exposure to pesticides, heavy metals, and other toxins. Now I will tell you about the diagnosis of male infertility. Well, many infertile couples have more than one cause of infertility, so it is likely you will both need to see a doctor. It might take a number of tests to determine the cause of infertility. In some cases, a cause is never identified. Infertility tests can be expensive and might not be covered by insurance. Find out what your medical plan covers ahead of time. Okay. Diagnosing male infertility problems usually involves general physical examination and medical history. This includes examining your genitals and asking questions about any inherited conditions, chronic health problems, illnesses, injuries, or surgeries that could affect fertility. Your doctor might also ask about your sexual habits and about your sexual development during puberty. Semen analysis. Semen samples can be obtained in a couple of different ways. You can provide a sample by masturbating and ejaculating into a special container at the doctor's office. Because of the religious and cultural beliefs, some men prefer an alternative method of semen collection. In such cases, semen can be collected by using a special condom during intercourse. Your semen is then sent to a laboratory to measure the number of sperm present and look for any abnormalities in the shape, that is morphology, and movement, that is motility of the sperm. The lab will also check your semen for signs of problems such as infections. Other sperm counts, often sperm counts fluctuate significantly from one specimen to the next. In most cases, several semen analysis tests are done over a period of time to ensure accurate results. If your sperm analysis is normal, your doctor will likely recommend thorough testing of your female partner before conducting any more male infertility tests. Your doctor might recommend additional tests to help identify the cause of your infertility. These can include scrotal ultrasound. This test uses high-frequency sound waves to produce images inside your body. A scrotal ultrasound can help your doctor to see if there is a varicocele or other problems in the testicles and supporting structures. Transrectal ultrasound. A small lubricated band is inserted into your rectum. It allows your doctor to check your prostate and look for the blockages of the tube that carry semen. Hormonal testing. Hormones produced by the pituitary gland, hypothalamus, and testicles play a key role in sexual development and sperm production. Abnormalities in other hormonal or organ system might also contribute to infertility. A blood test measures the level of testosterone and other hormones. Post-ejaculation urinalysis. Sperm in your urine can indicate your sperms are traveling backward into the bladder instead of out of your penis during ejaculation. This is known as retrograde ejaculation. Okay. Then we can carry out genetic tests that, when sperm concentration is extremely low, there could be a genetic cause. A blood test can reveal whether there are subtle changes in the Y chromosome, signs of a genetic abnormality. Genetic testing might be ordered to diagnose various congenital or inherited syndromes. Testicular biopsy. This test involves removing samples from the testicle with a needle. If the results of testicular biopsy show that sperm production is normal, your problem is likely caused by a blockage or another problem with sperm transport. Specialized sperm function test. A number of tests can be used to check how well your sperm survives after ejaculation, how well they can penetrate an egg, and whether there is any problem attaching to the egg. These tests are not often used and usually do not significantly change the recommendations for treatment. Now I will tell you the treatment. Often an exact cause of infertility cannot be found. Even if an exact cause is not clear, your doctor might be able to recommend treatments or procedures that will lead to conception. In cases of infertility, it is recommended that the female partner also be checked. There may be specific treatments recommended for your partner, or you may learn that proceeding with assisted reproductive techniques is appropriate in your situation. Treatments for male infertility include surgery. For example, a varicocele can often be surgically corrected or an obstructed vas deferens repaired. Prior vasectomies can be reversed. In cases where no sperms are present in the ejaculate, sperm can often be retrieved directly from the testicles or epididymis using sperm retrieval techniques. Treating infections. Antibiotic treatment might cure infection of the reproductive tract but does not always restore fertility. Treatments for sexual intercourse problems. Medication or counseling can help improve fertility in conditions such as erectile dysfunction or premature ejaculation. Hormonal treatments and medication. Your doctor might recommend hormonal replacement or medication in cases where infertility is caused by high or low levels of certain hormones or problems with the way the body uses hormones. Assisted reproductive technology, that is ART. ART treatments involve obtaining sperm through normal ejaculation, surgical extraction, or from donor individuals. Depending on your specific case and wishes, the sperm are then inserted into the female genital tract or used to perform in vitro fertilization, that is IVF, or intracytoplasmic sperm injections. In rare cases, male fertility problems cannot be treated and it is impossible for a man to father a child. Your doctor might suggest that you and your partner consider using sperm from a donor or adopting a child. Now I should tell you some lifestyle and home remedies. There are a few steps you can take at home to increase your chances of achieving pregnancy. First is that you can increase frequency of sex, having sexual intercourse every day or every other day beginning at least 5 days before ovulation increases your chances of getting your partner pregnant. Have sex when fertilization is possible. A woman is likely to become pregnant during ovulation, which occurs in the middle of the menstrual cycle between periods. This will ensure that sperm which can live several days and present when conception is possible. Avoid the use of lubricants. Products such as Astroglide or KY jelly, lotions, and saliva might impair sperm movement and function. Ask your doctor about sperm-safe lubricants. Live a healthy lifestyle. Eat a variety of healthy foods, maintain a healthy weight, get enough sleep, and exercise regularly. Avoid things that damage your overall health. Stop or reduce your use of alcohol, quit smoking, and do not use illicit drugs. Now I should tell you some role of alternative medicine. Evidence is limited on whether or how much herbs or supplements might help increase male fertility. None of these supplements treats a specific underlying cause of infertility such as sperm duct defect or chromosomal disorder. On YouTube there are so many videos from these quacks or people who are not qualified. I suggest everybody to avoid watching those videos because that treatment and the products they sell they may not be approved by FDA and they are not quality controlled. Okay, so these products by these kind of people who are like promoting their videos can be dangerous, so avoid those. Okay. You can post comments in the comment section about any particular product which you are taking from an individual who is not qualified, so I can tell about that authenticity of that product. Okay. Now I should tell you some supplements with studies that are showing some possible benefits by improving sperm count or quality. I mean, as a doctor, we recommend some supplements and that have been proven to show some benefit, but even these are not 100% guaranteed. Okay, but I should tell you these products. For example, there are tablets or capsules available which contain coenzyme Q10, folic acid and zinc combination, L-carnitine, selenium, vitamin C and vitamin E. So these products which I told you, they have some beneficial role, okay, for improving the quality and quantity of your sperm count. Okay. Also, you should talk with your doctor before taking any dietary supplement for male infertility. There is no clear evidence that they work, and some supplements may cause side effects or interact adversely with medications you take. Well, this was my video about male infertility. I hope you like this video, and if you have any questions, or if you are, as I told you, if you are taking certain products which you think that that might be beneficial or harmful, you can post that post about that product in the comment section. Thanks for watching this video. See you in next video. Bye for now.